Hello everyone, welcome to the ITLS Academy. Today we are going to discuss the topic that is your intra-test phase. Okay, intra-test phase, element of safe, effective, informed care. Intra-test phase means the phase during the test. Phase during the test. So which type of precaution we have to take during the testing phase and how we care the patient and which type of activity we are perform so that it will be effective for the effective for the patient's care, and also it give a valuable information related to the patient and the disease so that the doctors can choose a better treatment for treating that particular disease which are occur in a patient. So today's lecture is what it is: a intracist phase, element of safe, effective, and informed care. So let's start the lecture. Basic knowledge and required skill. Okay, so first of all, we are going to discuss about the basic knowledge related to the intra-test phase and the basic skill which is required for performing this task. So simply the intra-test are mostly focuses on the specimens and the tissue culture, and it also focuses on the environment in which the tests are performed and the assisting with the procedure and how this test is performed, and also provide us a emotional and the physical comfort and reassurance. Administering analgesics and sedatives, and also it monitored the vital sign of the patient, and also focuses on the other parameters which are performed during the testing. Like vital signs means that during the test is the blood pressure should not arises. Okay, and also the pulses rate should not arises. So these should be take care when we perform a testing. These all come under the category of the intra test care. So see what is written here. Intra-test care focuses on specimen or the tissue collection, monitoring the testing environment, performing or assisting with procedures, providing emotional and physical comfort, reassurance, and administering analgesic and sedatives, and monitoring the vital sign and other parameters during the testing. Now come to the next slide. Safe practices, proper collection of the specimens, minimizing the delay and providing the support to the patient, preparing or administering analgesia and sedative monitoring, various bioparameters as necessary. Okay, so if we talk about the different type of the bioparameters, that is your safe practices. That means that when we performing a test, we have to take a extra care. Environment should be free from any type of the contamination. Injections the injections that we are used for collecting the samples are free from any type of the contamination. Now the next is your proper collection of the specimens. Okay, this is very important. Okay, when we collect a specimen, we have to collect it proper in a proper way, otherwise it will be contaminated. Otherwise it will be contaminated. Okay, and we have also minimizing the delay, means that if we have to collect a specimen as soon as possible, we have to start the testing. Also providing the support to the patient, preparing or administering analgesia and sedative, monitoring various bioparameters as necessary, and also being alert so that if there is chances of any potential side effect or the complication occur during the intratest phase, so what we have to do, we have to take a extra care for performing all these activities. We have to alert it. Okay, is there any potential side effects are occur, or sometime during intratest phase there are complication are occur. So the person who are performing this test, they have to know that how they are dealing all these situations. Side effect or complications are integral activities of the intratest phase. Invasive procedure place patient at a greater risk of for complication. Okay, so what we have to do, we have to place that patient that if there is any risk or complication related to these and adverse event which are required ongoing vigilance and observation, monitoring fluid intake and loss. Okay, this is very important. When we are performing the test, we have to monitor that the amount of the fluid that are taken by the patient and the amount of fluid which are lost from the body of that particular patient. Body temperature should be measured, respiratory and the cardiovascular systems, like in a respiratory system, what we have to do, we have to take a pulse rate. And cardiovascular disease, sorry, in cardiovascular diseases we have to take a pulse rate. In respiratory system we have to monitor the activity of that lungs. We have to monitor the activity of the lungs, and treating problems in these domains required a critical thinking and quick responses. Okay, so these are what, these are the critical problems which are occur when we perform a test, or you can say that in a intra-test phase. So what we have to do, we have to take a quick response for in quick response for the treatment of all these complications. Now the next is your infection prevention. First of all, when a patient have an infection, okay, then it is very critical problem, because in sometimes this infection become the death of that particular patient, or even the person who are come in contact with that infection. Suppose that there is a who have an infection of something, okay, and we are taking a blood sample from a, but this B does not follow the proper protocol and does not prevent them from that infection which occur in a. So there is a higher chances that the infection from A are transferred to the B. So in this slide, what we have to do, we have to see that how we prevent the infection. Institute accepted infection prevention and control protocols. Okay, so different institute, they have what, they have their own infection prevention protocols and the infection control protocol. So first of all, what we have to do, we have to prevent that infection from spreading from one patient to the another. Okay, and if it is spreaded, then we have a protocol for controlling that particular type of the infection. Observe spatial measure and sterile technique as appropriate. Okay, so for preventing the infection and and for preventing the infection, or for controlling the infection, we have to follow over a special measurement, and we have to follow a sterile techniques. In sterile techniques means that all type of the microorganisms are killed. Identify the patient at risk for that particular infection. Suppose that there is a patient who have suffering from some infection. So what we have to do, we have to identify that patient. Now, such as immunocompromised patient, initiated strict respiratory and contact isolation necessary. Okay, if a person are suffering from an immunocompromised disease, okay, then what we have to do, we have to take a strict action. Okay, and we have to isolate that person, and we have to avoid it to come in contact with that particular type of the person. Quality assurance require a proper collection, transport and receipt of the specimens, and use of properly cleaned and prepared instrument and equipments. Okay, so quality assurance, what means that We all know that there is a difference between the quality control and the quality assurance. So this is a quality assurance, which means that we have to maintain the sterile condition at every step. Like when we have to collect a sample, we have to collect it in a proper way. Then the sample are transported in a proper way so that it will not be infected by some other things, or it should avoid the contamination. And receipt of the specimens. Okay, so receipt should be mentioned on the specimens, and use of proper, we have to use a properly clean and prepared instrument and the equipment for performing the infected specimen. Appendix A offer more information on the standard precaution for safe practices, infection control, isolation, quarantine surveillance, and reporting. The term standard precaution refer to a system of the disease control that presupposes that each direct contact with body fluid or tissues is potentially infectious, and that every person exposed to these must protect himself or herself. So this is about the infection prevention. Now come to the next slide. Consequently, healthcare worker must be both informed and conscientious about adhering to a standard precaution. Okay, so the healthcare worker have what they have a proper information for about the standard precaution and the strict infection control guidelines. There is a strict infection control guidelines. So the health worker should have followed these guidelines. Okay, and it goes without saying that healthcare worker must be scrupulous about proper hand hygiene. Okay, so this is a duty of the healthcare worker that they have to follow the proper hand hygiene. Means that they have to wash their hand at every 20 minutes. It is mandatory for them. According to the Center for Disease Control and Prevention, that is your CDC. CDC is what? It is a Center for Disease Control and Prevention. Proper hand hygiene must be practiced before patient contact and before donning the gloves. Okay, so here, according to the Center for Disease Control and Prevention, that is CDC, they said that we have to follow a proper hygiene condition when before patient contact. When we have to go for a patient contact, before it we have to wash our hand in a proper way, and before donning the gloves. So this is what, before donning the gloves we have to wash our hand. When inserting the catheters or other devices that do not require a surgery, and after contact with the patient skin, these are what, these are a condition in which we have to maintain a proper hand hygiene condition. So when a healthcare worker come in contact with the body fluid, then what they have to do, they have to wash their hand, or wound dressing, and after removing the gloves. So these are the condition at which hand hygiene should be followed. Proper protective clothing, other devices, or PPE. PPE must be worn as necessary. Okay, if it is necessary, then what we have, then what healthcare worker do? They have to wear a proper PPE kit. Procurement and disposal of the specimen according to the US Occupational Safety and Health Administration, that is OSHA. According to OSHA, what is the guidelines of that OSHA? According to them, they have to procurement or disposal of this specimen should be done. Standard must be adhered to. Moreover, institution may have procedures and policy of their own to ensure the compliance. Example, specimens are to be placed directly into the biohazards bag. Okay, so what the specimen, what they do, they do not put this specimen in some elsewhere. What they have to do, they have to put it into a biohazard bag. Collaborative approaches. Collaborative team approaches is necessary for most procedure. Collaborative team approach means that the teamwork. So this teamwork are very important in most of the procedure. Clinicals must assist understand each other role in the procedures. So what they have to do, they have to know that each other role. Suppose that some surgery are performing in a hospital. Now for performing this surgery, this is not a single work. Okay, like doctor go and do a surgery. No, but it is a teamwork. Some nurses are there, anesthesias doctor are there, surgeons are there, like physicians are there. So these are what, these are the uh, teamwork. Okay, and they have to know their responsibilities, their roles, and how they assist to each other. Invasive procedure, for example, lumbar puncture, cystoscopy, place patient at greater risk for complication and usually required a closer monitoring during the test. Frequently, administration of the intravenous sedation and other drug is a part of the procedure. As to ongoing observation of the patient and critical thinking and quick decision making skill during the intense situation are requisites for the clinicals in these settings. Okay, now the next is your risk management. Assist for and provide a safe environment for the patient at all time. Okay, so what we have to do, we have to provide a proper safe environment to the patient at all times so that it will avoided the chances of the infection, avoided the chances of the infection. Identify the patient at risk and environment that may pose a risk. Okay, what we have to do, we have to identify the patient which have a high risk of that infection, and even we have to identify the environment which have a high risk of the infection so that it will transfer to the patient. Previous falls, cerebrovascular accident, neuromuscular disorder, loss of balance, and use of ambulatory and assistive device are contributory risk factor. So these are what? Previous fall, cerebrovascular accident, that is also known as a CVA, neuromuscular disorders, loss of the balance, and also the use of the ambulatory and other assistive device. They are what they do, they are contribute to the risk factor. Prevention of the complication and other management of risk factor, they are what they are, they have an important part of the intratest phase. What is the important part of the uh, intratest phase? That is your prevention of the complication and management of the risk factor. As part of the risk management, observe standard precautions and infection which are controlled by the protocols as necessary. Okay, so for observing the standard precaution and infection, we have to follow a protocol. Use a special care during a procedure which is required iodine and barium contrast. Okay, so if there is a procedure in which iodine and a barium contrast are uses, or radiopharmaceuticals, latex products, sedation and analgesia are uses, so at that time special care uh, should be required during that type of the procedure. Certain risk factor also contributed to a higher incidence of the adverse reaction when contrast agent and the radiopharmaceuticals are used. Remove the jewelry, false teeth, and other prosthetic devices such as necessary. Check for NPO or fasting status if appropriate. if appropriate. Okay, if it is requirement of the NPO or the fasting status, so we have to check it. And during some procedure we have to remove the jewelries, false teeth and other prosthetic devices if it is necessary for them, like your CT scan and all. Classification of risk factor for higher incidence of adverse reaction when contrast agent radiopharmaceuticals are used. So the first table is for a pre-existing disorder and the second table is for a other contributing elements: asthma, allergy, diabetes, age-related, newborn and older adult, liver insufficiency, dehydration, multiple myeloma, frequent use of the contrast agent, uh, few chromocytoma, high doses of the contrast and radiopharmaceuticals, renal failure, previous reaction to the contrast agent, and the Caesar history. So these are the table. Now the next is your specimens and the procedure. Conduct or assist with certain diagnostic procedure. Okay, so what we have to do, we have to conduct or assist with that particular or certain type of the diagnostic procedure. For example, types of assisted procedure include endoscopy, lumbar puncture, and cardiac catheterization. Diagnostic procedure often performed independently of other medical personnel include papinocola, that is your pap test, centrifugation of the blood sample, ECG, breathing test, pulse oximetry. For example, the pulse oximetry is used to monitor the non-invasively the oxygen saturation, that is known as a SpO2. SpO2 refer as a pulse oximetry, whereas SaO2, there is a difference between SpO2 and SaO2. SpO2 is what it is referred the pulse oximetry, and SaO2 refer the arterial saturation, which measure on a arterial blood sample. Sensors may be applied on the index, middle or ring finger, on the nose, ear loop, toe, foot and on the forehead. Be aware of the factor which interfere with accurate result, like patient movement, ambient light, electronic interference, artificial nails, polish, anemia, edema or poor circulation to an area. Now the next is your collecting specimens and conducting procedure. They are what? They are a main intervention in the diagnostic pre-test and intra-test phase. So these two things are very important. The first is your collecting the specimens. Okay, how we collect the samples and how we perform the test. That is your conducting procedure. They are the two main intervention in the diagnostic, that is your pre-test or intra-test phase. Procure, process, transport and store specimens properly. The community environment and healthcare setting in which testing take place dictate protocol for doing this. Everyone involved in the process must have a true understanding of the testing principles and protocol and must adhere to them to ensure the accurate result. Determine the specimen's type, needed and method of the sample procurement. Special equipments and supply may be necessary. For example, sterile container and the special kits. Collection by the patient required a patient cooperation. Okay, patient cooperation is very important when we have to collect the sample from a by the patient. Understanding and instruction. It does not always require a direct supervision. Direct supervision is not always required. Conversely, supervised collecting required supervision of the patient by a trained personnel during a specimen collection. For example, of these two type of the collection, which included a routine urine sample which are collected by the patient privately versus urine sample procured in a supervised setting for a drug screening. There are two different things. How the Patient collect the urine for a sample. It is collected by a privately, and even the urine sample are procured in a supervised setting for a drug screening. A third method of the collection required that a clinician perform the entire collection. For example of this type of that collection is what? It is a aspirating a urine sample from an indwelling catheter. Okay. Time of the collection is also important. For example, result from a fasting blood glucose test versus resulting from glucose tolerant test are significantly different as diagnostic parameters. Specimens can be rejected for analysis because of factors which are related to the specimen itself or to the collection process. Sometimes due to the specimens, and also due to the collection process, the specimens are rejected. They are not fit for the analysis. Blood collection is normally done by a trained person. Okay, this blood collection is very important. It is only done by a what? By a trained person. An exception is the self test for glucose using a equipment designed especially for that purpose. Okay, so for the testing of the blood glucose level, it is not required a trained person, because there is a equipment which are specially designed for performing that function. Okay, it can perform by the patient or some other person also, but for a proper blood collection, trained person are required. The time of the collection is an important factor. A sequence of the sample for a cardiac panel. For example, a peak drug level blood specimens is collected when the highest drug concentration in the blood is expected. This type of test is used for therapeutic drug management and dosing. Conversely, a throw sample is collected when lowest drug concentration is expected. These type of the tests are used for a therapeutic drug monitoring, and specimens are collected which give a resulted proper reported before the next scheduled dose of the medication. Now, error in a collection. So, specimens error and a collector error. The first column is for a specimens error, and the second column is for a collected error. Insufficient volume, improper time, insufficient number of the sample, wrong transport medium or wrong or absent preservative, storage at incorrect temperature, incorrect order of the draw, improper centrifugation time, clotted sample, hemolyzed sample, or diluted sample. They are what? They are the error which are occur due to the specimens. Suppose that the volume of the specimens are insufficient, so that it will not use in a proper way, and then the error are occur. Improper type. Sometimes there is an insufficient number of the sample. Sometimes the samples are transferred from a wrong transport medium, or wrong, or even sometimes the absent of the preservative. Sometimes the specimens are stored in a incorrect temperature. Sometimes it is stored in a incorrect order, and centrifugation time should not be properly followed. Sometimes the specimens are clotted. Sometimes the samples are hemolyzed, and sometimes the samples are diluted. Next error is your collected error. It occurred during the transport delay, improper collection method, wrong specimens container, incorrect documentation, wrong date or time, incorrect storage, air bubbles in a tube, unlabeled or a mislabeled specimens, or a wrong patient identification information, improperly completed form or a computer data entry, test tape cut in half, discrepancies between test order and a specimens collected, failure to a properly transcript and process orders. Now the next is your legal and forensic specimens. They are what? They are collected as a evidence in legal proceeding. Okay, so legal and the forensic specimens, they are collected for as a evidence for a legal proceeding, for criminal investigation, and after death. For example, DNA samples, drug and alcohol level, Factors like chain of the custody situation and witness collection may be involved. So there is the following list which addresses some general comment about the specimens collection. The first one is your stool and urine collection, required clean dry container and kits. Time urine collection required refrigeration or a container with a special additives. Sterile dry container and special kits are needed for a midstream clean catch urine specimens. Oral saliva sputum specimens require specific techniques and kits, and sometimes special preservatives are also required. Blood collection equipments like your gloves, needles, collection tubes, syringes, tourniquets, needle disposal containers, lancets for skin puncture, cleanizing agent, antimicrobial skin pepper preparations, and adhesive bandages. Color coded stoppers and tubes which indicated the type of the additive present in the collection tube. Additive preserve these specimens and it also prevent the deterioration and coagulation or the block action of the certain enzymes in a blood cells. So these are the tables which shows that the blood specimen collection and uses the preventions. Okay, same this is also for that. Tubes with anticoagulants should be gently and completely inverted. 7 to 10 tubes after the collection. This process ensure complete mixing of the anticoagulant with the blood sample and prevent a clot formation. Store specimens properly after collecting or transport them to the laboratory immediately. Okay, so what we have to do when we collect these specimens, we have to store it in a proper way after the collecting and transport it as soon as possible to the laboratory for the processing and analysis if possible. Failure to do so may result in specimen deterioration. Stat order test should be always be hand delivered to the laboratory then processed as a stat. Unacceptable specimen leads to increased cost and time wasted in getting result to the clinical, patient, institution, and third party payer. Exposure to the sunlight, air, or other substances and warming or cooling can alter the specimen integrity. Check with the laboratory for proper storage like ice water separate from ice, transport and time limit. As environment for specimens collection become more variable, modified procedures and protocols which is required the clinical to keep abreast of the latest information related to these factors. So this is all about the today's lecture. I hope you will understand, but if you have any query related to this topic, you are freely to ask me in a comment box, or for a further detail you can follow the ITLS Academy on different platform, that is Instagram, Facebook, Twitter, YouTube, WhatsApp, LinkedIn, and subscribe our channel ITLS Academy on YouTube and get our app from a Google Play. You can also visit our website, that is www.itlsacademy.com, or ask your query to the helpline number that are already mentioned in your slide, that is 7080833450. Thank you for watching. Please like, share, and subscribe our channel.